Hello, my name is Amy Mansu, and I'm thrilled to have this opportunity to be with you today to do a couple of things. First of all, this is our annual meeting with the community. It gives you the opportunity to ask questions and be part of a dialogue. Our board of directors has challenged us to really look for spaces in order to have conversations. So in that vein, the next slide will share with you our summary of what today's presentation is and what the objectives are and what relevant points are that I think I want you to take away from, and then some things for you to consider. If there are questions before I go into after I read the mission, vision, and values, I'll be glad to take them. If not, I'll just go through the deck and proceed to then be able to answer any questions as we go along. You do not need to feel compelled to ask questions, but if indeed you have them, I want you to see that this is your opportunity from the community to ask any questions you want of me and of the Inspira Health System. So why are we doing this? The New Jersey law a few years ago, the legislature and the governor passed a law that said, look, we need to provide the opportunity for the community to have once a year a dialogue with their health system to understand what the goals are, what your financials look like, and to make sure that if there's anything going on that is not apparent to the community, that that they have a chance to ask questions and actually have dialogue. So the relevant points are just some high level, right? Inspira is a 6,500 employee organization, almost $1 billion. We serve a 6-county region. Well, obviously our homes are in the counties that people know where our footprint is, where our hospitals exist, Cumberland, Salem, and in Gloucester County. We also have a lot of assets throughout the entire area, both our urgent care centers, which many of you use and see, as well as our physicians' offices and our ambulance squad, which actually now covers multiple counties, and very excited about our continued effort to grow our footprint there and be able to serve you. You can't talk about 2020 without talking about COVID and the tremendous impact it had both on our employees as caregivers, on all of you as patients, and how trusted we were to try and help the community fight this battle, not only for those who entered our hospital, but also in vaccinating so many of you. And we were grateful to have the opportunity to do that, whether it be at our Vineland campus or our Mullica Hill campus. Obviously, we're providing COVID testing, and we continue to provide COVID testing to so many, but it has changed the dynamic of how we interact. We've done a whole lot of things that I'll be glad to talk about today in reference to your safety and the safety of our workforce. But the good news is, even in spite of this, which continues to be a challenge, literally as I was jumping on the call today, the governor's issuing orders in reference to really tracking and understanding how many healthcare workers are vaccinated and really making sure that we can protect our patients and employees as we go forward. And also, we could not be standing here before you if it were not for the support of the state and federal government. The federal funds that came through the CARES Act were essential to us, and the state's steady hand in providing us the constant information that we needed to be able to care for you was critical as we were approaching the COVID surges, especially, and even now as we continue to see some of those spikes continue in the transmission rates. So some things that you may want to consider, if you're asking, if I was to pose what are the most important questions that I think part of this presentation is, how are you ready for what may be the next wave? And have we done all the things that we need to do? How have we fulfilled what is called a community health needs assessment? That's a federal law that actually was created over a decade ago to really look at what the needs are of the community and how we've responded to that. And the deck obviously talks about that. And then what are areas that we see of future growth? The deck I'm referencing, if I have time to go through all of it, I will indeed do so. But if not, if you've registered, we will go ahead and send it to you. And then that way you will have it in your inbox tomorrow, and then you can reference it. And of course, you can always email back and forth to us to make sure that we have answered any questions that you may have. So I'll start with the update in our strategic plan. And this was an update of our mission and our vision. And really this came from our employees wanting so much to see themselves as an essential part of everything we do. And so our mission is to provide a safe and compassionate experience that improves the health and well-being of our community by placing the safety of our patients and the support of our employees at the center of all we do. We never would have been able to make it through some of the darkest days of COVID if we had not had our employees at the center of everything we did. Being able to make sure that we provided the safety tools that they needed to care for our patients, as well as create the supports that they needed just to be strong enough and resilient enough to be able to care for their family at the same time they were caring for us. And I can't say enough about our healthcare heroes and our clinicians and all people who participated in this process, because it took every member of our 6,500 employee team to be able to do this. And our vision is that Inspira Health inspires and empowers healthier communities by creating the highest quality and most desirable patient experience in the region. That partnership with our patients is at the center of everything we do, because we know that while we can provide care when you come in to serve us, that it's really those things you do the other 363 days a year that make a difference in how your health is and how you manage your health. So making sure that we have that strong partnership and that constant communication is critical. And then our values. Our employees said to us very clearly that they want to see themselves at the center of our values. So we created the acronym with their suggestions, I create. While the I stands for innovation, constantly striving to make sure that we are uniquely identifying the needs, but most importantly, providing every standard of care each and every day that provides both safety as well as the best expertise. Compassion, that we treat everyone equally with kindness and compassion. And, sometimes everybody's in crisis when they come into a hospital. They're not looking to be here. And so it really makes sure that we're understanding of where they're coming and how they're approaching things, especially with the world being as difficult as it can be and how it's testing all of us. Reliability, that we put the safety of our patients and compliance and best practices in the forefront of everything we do. Empathy, that we listen and genuinely relate to others in order to make them feel seen and appreciated. All of us come with different views of how we access our care and how we want to be treated. And we need to make sure that we're really listening with our whole hearts as we're making assessments and doing all that we can to take care of our patients and our community. Access, that we will provide a high quality patient experience to all people. We can get the door open, but we need to make sure that we're meeting you where you are to be able to ensure that high quality of care is delivered. Teamwork. Nothing knows better than this year. We could never have gotten through COVID without the teamwork, that we collaborate, utilize the full breadth of Inspira's network to improve the experience of our patients. So while you may be seeing one physician or one team of people, that full force of the 6,500 employees, as well as our larger community physicians, are with us in this conversation as we're working to create healthier communities. And lastly, and probably one of the most important, is empowerment, that we educate and inspire positive change and healthier long-term outcomes. We sit as Cumberland and Salem counties with two of the counties that have the greatest number of challenges in reference to reaching those health outcomes. And so it's important that we look not only just as our healthcare provider, but what we need to do as partners in the community to create those safe environments that have access to food and shelter and education and all of those things necessary to create the environment that people can thrive in. So I'm going to take a pause right now. And before I jump into our strategic plan, I'm going to ask my colleagues who are entertaining questions if there's anything that you would like me to answer as part of that. Megan Elaine is with me today. So Megan, is there anything that any questions that have come in that you probably can see that I can't see?
There are no questions just yet.
Okay, Megan, so let's go forward then to the next slide. So let me talk about the future of our strategic planning process. This single slide shows you everything that you really need to know. We've broken everything down into 5 priorities, 5 domain categories, and you can see those listed on the top. At the bottom, we've tried to address the elements of all of these things. And in these elements, it really is what we've talked about is all those things are necessary to be able to support it. So in our quality and clinical care, we've set some really lofty goals at making sure we're in that top 25th percentile across the nation over multiple years. Our medical staff and physicians, we know that many of our physicians have been with us a long period of time and given their entire careers to us. And now as they approach retirement, we have an obligation, whether it be community physicians or employed physicians within Inspira, that we make sure that we have that succession planning available to really be able to meet the needs of our community. The second is patient consumer centric accessibility and convenience. And what those are a bunch of words that say, look, we got to meet patients where they are. Patients now post-COVID, they know they can see their doctor through a feature like this on a computer or even on an iPhone. They want to be able to have easy access. They want to be able to schedule themselves. They want to make sure that they have a constant access to their patient information. And they want it easily through our portal, and they want lots of interaction with us. And so making sure that we really meet them regardless of they want to come to an office or they want to use telehealth. We've got to be there. Talent acquisition and development. We can't do anything without our most talented resource and our most important resource, which is our staff and our physicians. So whether we are engaging our community physicians, whether we are hiring more staff, making sure that we have that constant pipeline, and that even when they're here, that we're constantly providing opportunities for training and improvement in their skills. And lastly, our population health and community management, sort of what we talked about, this whole needs assessment of our community. What are the things that are going to make a difference, and how do we meet our community members where they are to be able to best care for them? So we're very grateful to our patients, and we go through a couple of quick stories here that really feature some of the amazing work that was done through our COVID times. And so if I'll ask Megan just to flip to the next slide, and we'll be able to talk a little bit about those patients. So the first one is Juan Duran. Juan is one of our early COVID patients who was discharged from Violent. He spent 48 days in there, and you can see the joy captured in there as the staff worked with him each and every day to be able to provide him the necessary care so he can indeed do exactly what he's doing now, which is hugging his children, and you can see the support of our own team members around them. And it just was a beautiful thing to be able to meet his family. And remember, because we didn't allow visitors at that time, our staff members were serving as the go-betweens with the family to make sure that we were keeping people fully engaged. And so we're so proud of the work the team did, and I'm so proud of Juan as well for really having the courage to fight through that. And you can see his quote here: "I loved all the staff, and they definitely made my stay so much easier and pleasant despite my medical concerns." The next slide I want to talk to you about talks about Yvette Thomas, and Yvette too was a COVID survivor. She spent 10 days in the hospital, and she is so thankful that it wasn't longer. But it wasn't longer because of the great work our team did. We were able to put Yvette on a home monitoring program, and you can see she's got the little computer on her finger that tells her what her blood flow is and what her oxygen rates are, and that sets up to our central monitoring system in one of our companies called Theus that we started with as a startup. And that company allows us to really benefit from all of this, to be able to get people out of the hospitals, because we had many people coming into those hospitals beds, and most importantly, Yvette wanted to be home. So we were able to provide that around the clock monitoring that she so desperately needed, and that we had to make sure that we had the technology, going back to that consumer centric, that we could provide for her. And you can see her quote right here, that being only a phone call away was so very, very important to Yvette, and so important to our staff to be able to really engage with her. So if I go to the next slide, I'll just stop right here and ask Megan if there are any questions, or I can keep going.
No questions yet. You can keep going.
Okay, so the community benefit, we talked a little bit about this, and this is what our community needs assessment told us. So 19 to 21, the years that we're just ending, it talks about the obesity, substance abuse, mental health and behavioral health, access to clinical care, and transportation being as the critical issues in our communities, things that are getting in the way necessarily of how to access those health outcomes that I talked about, the things that I mentioned that rate rate the counties on how they're doing. All these things are part of that, and being able to make sure we have a breadth and depth of services in these areas are part of it. The needs assessment for 21 to 2023 is going on right now. We're about to launch that. Our stakeholders are involved. We'll be asking them for their feedback, gathering data, and then preparing that as part of our next annual meeting that we'll be sharing with you what those results are. I'm going to ask Megan to go back a slide because I jumped in and I didn't get a chance to talk about all of the funding that we have spent in trying to address some of these issues. And then you can see through 18 through 20, these are the specific programs or dollars that were set aside to be able to address some of these areas. And then there was a whole range of things. Some of this is actually in clinical care that we're giving, but some of it is very uniquely related to the health assessments that came up and some partnerships that we've actually invested in through the community. So we're very proud of our commitment and very proud of being able to have these types of dollars to be able to invest and support to improve the community health. Megan, did I see a question come up?
You did. It was about the skipped slide, but we went back and addressed that. So
okay, thank you very much.
Sure.
Okay, so Megan, I'm going to keep going then. You can go right to the next slide, because so that way we can talk about some of the things that we've also done as we've looked at how to deal with the issue of drug abuse and really trying to think about how to deal with some of those safety issues. We actually distributed doTERRA pouches, which allows for you to actually pack up those medications, which are, you know, often when people are sick, they don't use them all, they store them, and those medications can actually be very fatal to people if they take them for the wrong things. So we created these pouches, which were then distributed, almost 1,000 pouches, to then be able to use and be able to collect those drugs and bring them back in. Probably one of the most important things was the life-saving drug Narcan. And this is a drug that allows us to actually real time, if somebody is an overdose, inject this drug and be able to help them avoid that overdose. Our police departments use this, and we were able to distribute over 340 of the naloxone and then 340 of the nasal atomizers. These are critical in our tools of dealing with addiction, as well as dealing with what we've seen in overdoses in our community. The next slide is one we talk about a lot, which is our importance for the access to healthy foods. We know that many of our communities have food deserts and they don't have access. So being able to provide the amounts of foods, we have done 1,300 pounds of food for those seniors in our LIFE program, 350 pounds of food for our 23 families in Cumberland. We have seen a tremendous increase in the number of people who are using food banks. So you can see the increase in Woodbury, Vineland, and Millville through our school program, where they are actually distributing to low-income families. You know, when the schools were closed, it was very hard for those children to have access to what they used to have access to, which is those daily meals. And so being able to get to the food to the families real time really showed the partnership with these three community leaders. And of course, the 3,000 pounds of produce in Cumberland County with the Farmers Against Hunger, that partnership is just some examples of how we're trying to meet the needs of our community, regardless of whether they fit in a hospital-based environment. But we know if you don't have access to food, then you can't actually be healthy to be able to heal and do the things you need. One of the exciting programs that we've invested in is Housing First. This is a Cumberland County nonprofit was dedicated to alleviating hunger, reducing poverty, reducing crime, all through the concept of getting homeless people off the streets and into their own homes. And we were so proud to participate in this, and since 2017 have given over $200,000, but also you can see our team members who are actually there to place the 100th person in their new home. And we're so grateful for our Inspira family who shows up and is present, not only in caring for you, but in our community activities as well. And I want to thank the behavioral health team who has really led the way with Housing First in this tremendous partnership. And we know that these 100 units may just be a small drop in the bucket, but it's a very important drop for each individual who's now off the street and has a home. We can't have a community benefit without talking about vaccines. We have given over 100,000 vaccines since we started in December, and we're so very proud of all of that work. Candidly, I'd wish that number were higher, because we know that we have many people left to vaccinate. The number over the weekend that was released was 150 million Americans that are eligible to receive the vaccine, have not yet received it. And so we know that this is part of the reason why we're continuing to see the Delta variant spread, and one of our highest priorities right now, and really making sure that we're able to stop that spread. So you can also see, not only are we providing the vaccine as we have in Mullica Hill and Vineland, we continue to do that to this day at our hospitals. We also are administering in schools, and we've given out over 4,000 vaccines, both to teachers as well as students. We know that we have many parents that are anxiously awaiting guidance from the feds on when the 12 and under will be getting their vaccine. And obviously, we will stand ready to support that at any time that comes. We also have a mobile vaccine that is actually going to the homebound to be able to administer that way, and do our homebound visits as well, partnering again with local communities. It's so important that we have these strong relationships, whether they be with local nonprofits or with government organizations within our local cities and towns and counties. They've been great partners for us, and we're so grateful that we have the chance to do this. So all of this, of course, then leads us into our finances. So how did we do, and where do we stand? So this gives you some of the statistics, and these admission numbers are actually a little down from what we've seen before, because we know that for some period of time we actually were not able to perform surgeries and do some of those things when we were in lockdown. Anything that was elective, of course, everything was urgent, obviously was cared for. But we also have seen a real reduction in the number of people coming to our emergency room, about a 19 to 20% drop nationwide, and our numbers are about the same, a little lower. But what we really worry about is that we continue to see people coming to the hospital much sicker than before. And so that fear of being with other sick people, or that fear of trying to just delay care, really is something that concerns us as healthcare workers. And I'll just take the moment to stress here that we really need to make sure that if you aren't feeling well, that you really listen to your body and go see your physician. And if you're not able to get in to see your doctor because it's after hours, please come to the emergency room and do what you need to do so we can make sure that you're okay. And this gives you some of the statistics. But then I know that one of the next slides is really asking about what is the health of the hospital in reference to our financial health. And so you can see that it has been a very difficult year. And if it had not been for those COVID-19 subsidies, we would have had a much different picture in reference to our losses. That the one caveat I will say is, as you look at those subsidies, they were really to provide that bridge for us to be able to reopen. And we know there will be no additional federal dollars. So we are continuing to incur costs into 2021. These were just the 2020. And we know that there's at least, a significant number of costs that have come into 2020 as we stood up the vaccine tents, as we've had to provide all of the things we just talked about. And as well as continuing to cover the losses that we had in 2020. So we continue to have our budget. We continue to move forward. And obviously, if there are dollars that are not spent, then we will return those to the federal government. But at the pace we're going, we expect that we will actually be spending all of those dollars as we move forward. So I now have come to my last slide, which are questions, and I'm glad to make myself available if there are any questions on the line, Megan.
Hi, yes, we do have one question, and it's from the hot off the press government mandate from the governor that came through. Can you speak to that?
Certainly, Megan. Thank you so much.
Sure.
So the governor announced at noon today that he would be mandating that all healthcare workers become vaccinated. And we have the hospitals and long-term care organizations have till September 7th to share with him what our current vaccination rates are, or share with him the plan on how we're going to test people. And specifically in his comments, he cites the division of the Department of Military and Veterans Affairs, that in their veterans' homes actually are testing workers 3 times a week. And he points to that as something that we should look at as a best practice. Not saying that he's requiring us to do it, but that he does want to make sure that there are no healthcare workers who could unintentionally come to work with COVID and share and spread that to our patients or each other for that matter. And so we are fast off the press as we are literally going through this, looking at and understanding what that means and what he's going to ask for. We, as many hospitals have been working very hard to provide the opportunity for our employees to be vaccinated, as well as our community members. There continue to be a number of questions from specific groups of people. There are sort of the group of people who are going to wait until the FDA actually removes the emergency use approval, that they want to see that it's a fully approved vaccine. There are another group of people who are in childbearing age, both men and women, who are saying, I have real concerns about what happens to my children if I should do this, make this decision now. The OBGYNs that we work with and others have been very clear that it is the risk of the vaccine is much less than the risk of COVID. And we know the impacts of COVID are very different based upon all sorts of indicators that I'm not sure that we fully understand, but we do know that people with underlying health conditions obviously are at much greater risk. And so at a minimum, for those individuals who may be of childbearing age and have underlying conditions, the COVID vaccine is absolutely, without a question, the way to go. But even if you don't have underlying conditions, you should protect yourself moving forward. And we know that vaccine indeed does that. And so there also are a group of people who may have medical reasons why they're not going to get it. And, we continue to try and answer those questions as we go up. But obviously, we'll work with the governor and comply with whatever information he needs. I cannot say enough about how important that relationship was with the state as we went through COVID, and having that partnership and that access to their data was critically important to help us in the planning for our staffing, as well as all of the necessary things that we needed to be able to meet the community's needs. Anything else, Megan?
There are no additional questions at this time. I'm going to add some additional information into the chat box, directing everyone to the website for more content, as well as an email address where you can send and submit questions after the fact.
Thank you, Megan. I will just make sure that I offer my tremendous gratitude for all of the support the community has given us through COVID and through these very difficult times. You were right there with our healthcare workers, bringing us food, donating resources, providing PPE when we had challenges reaching it. So we are grateful. We are grateful for the partnership, and we are so grateful for all of you that you trust us to be your healthcare provider. And I just want to, again, thank you for the opportunity today to present. Please, if you have questions after this, you're welcome to ask them, and we'll have a team that will get back to you. But lastly, I just wish you to be well and stay safe until we meet again. Thank you.